Hi, welcome to Southern Health Podcasts. This podcast is all about the Quality Improvement Team. Next week, they're running a QI Certified Leaders course aimed to train up staff within Southern Health, give them a better understanding of QI and be instrumental in our continuous improvement programmes within Southern Health. We caught up with James, one of the candidates for the course next week, to find out what his initial thoughts were.
So I'm James, I'm the admin manager for diabetes and respiratory. I've only moved over to Southern Health back in October last year, so it's still quite new in the trust. However, I was working for Hampshire Hospitals prior to this, so I was doing quite a similar role there for 2 years. So I've worked in the NHS for years, so I've worked since I was about 17, 18, so I've been in for like 15 years now. So yeah, it's definitely something I'm quite passionate about within the NHS, and also patient care. That's my biggest thing. I'm quite patient focused, and that's what I really want. That's the part I enjoy the most, so that's the bit I want to focus this on, really, because that's what I'm passionate about.
And James, you're starting the QI Certified Leaders course next Monday. Tell us a bit about why you wanted to go on that course.
Well, for me, it's because I feel there's always room for improvement, and I feel like I in myself want to develop, and I feel like going on this course will develop my skill set and help me improve certain things across the team that I manage. And like I say, I'd like to sort of streamline the processes a bit better, and I'm sure there's ways around of how you can improve that, and I think this course will help me know what to do in that sense and help me develop those changes, I'm hoping.
And what are you most looking forward to about next week?
I think it's going to be really refreshing to do something a bit different and also meet new staff members across the trust and interact with different people and just work on something a bit different to what I'm doing day to day. And I'm just excited to try something different and improve.
Anything you're a bit apprehensive about next week?
Yeah, I think it's knowing what to expect, really, because I think I'm not completely clear on what I will be, what will happen, what we'll have to do. So it's those little things that make me a bit apprehensive, a bit nervous, but I'm excited for it at the same time. So I think that's always a normal reaction to have, I think, when you're not doing something you're not familiar with. But yeah, I think the most thing I'm excited about is developing my skill set and meeting new people in the trust and learning what they do and what they want to improve in their roles and teams. That was one of the things that sort of interested me initially, was because I thought that's going to help me probably develop my skills and also develop improvement across the team. So I thought it was a win-win situation.
Excellent. And James, is it all right if we catch up with you next week, halfway through your journey? When you're doing the cohort 8, we'll catch up again.
Yeah, definitely.
And see how your first few days of training are going.
Yeah,
excellent.
I'm happy for that. Yeah.
Oh, well, thanks for joining us today. And you can catch up with James next week when we find out how his first few days have gone with his training course. Thank you.
Brilliant.
Thank you, James, for sharing your initial thoughts. We'll catch up with James again next week. In the meantime, please follow us on Twitter at shft_transforms or visit our website www.southernhealth.nhs.uk/QI. Thank you for listening.